Next, from the British Columbia Association of Chiefs of Police, Fiona Wilson. Welcome to the committee. Ms. Wilson, you have the floor.
Thank you. Good afternoon, everyone. In my role as president of the British Columbia Association of Chiefs of Police, I'm honored to share with the House of Commons Standing Committee on Health our experience as police leaders with decriminalization in British Columbia. The decriminalization exemption was issued under Section 56(1) of the Controlled Drugs and Substances Act by Health Canada, and it took effect over a year ago on January 31st, 2023. The exemption is part of a 3-year pilot that aims to take a health-led approach to substance use as opposed to one led by the criminal justice system. In British Columbia, we know all too well the severity of the toxic drug death crisis. Yesterday marked 8 years since a public health emergency was declared in British Columbia on April 14th, 2016. Since that time, tragically, more than 14,000 British Columbians have died from accidental overdose. We've seen the crisis have the greatest per capita impact on rural communities, including those in northern British Columbia, on Vancouver Island, and in the Cariboo. In many of these rural communities, the crisis can be double or triple the provincial average. Sadly, the highest per capita impact has been in Vancouver Centre North, which includes Vancouver's downtown east side. Here, the stark reality is that the overdose crisis is more than 12 times the provincial average. We recognize that the crisis has had an especially devastating impact on Indigenous people in British Columbia. Alarmingly, Indigenous people are 6 times more likely to be impacted by the crisis than non-Indigenous British Columbians. In recognition of the magnitude of this crisis, police leaders in BC supported decriminalization and taking a medically led approach to substance use. At the heart of it, police agree that people should not be criminalized as a result of their personal drug use. In terms of police data, across British Columbia, there's been a more than 90% reduction in drug seizures at or below the 2.5 gram threshold. Based on these results, I'm confident that frontline police officers are doing their part to implement the decriminalization exemption and to support a health-led approach to substance use. However, the implementation of decriminalization has not occurred without criticism or concerns. As police leaders, we were unequivocal about the need to prevent unintended impacts on community safety and well-being, especially for youth. The British Columbia Association of Chiefs of Police clearly identified some of those potential consequences prior to the submission of the exemption request, both orally and in writing. These serious concerns included, but were not limited to, the matters of public consumption in licensed establishment and other places such as cafes and restaurants, and impaired driving. However, the implementation of decriminalization occurred before more fulsome restrictions on public consumption and problematic substance use could be adopted. While the vast majority of people who use drugs do not want to do so in a manner that negatively impacts others, there have been several high-profile instances of problematic drug use at public locations, including parks, beaches, and around public transit. In addition, there have been concerns from small businesses about problematic drug use that prevents access by customers or negatively affects operations. To address some of these concerns, after significant advocacy on the part of police in BC, 3 additional exceptions were added to the exemption on September 18, 2023. In addition, the province of British Columbia has taken significant steps to enact legislation that would prevent problematic substance use that negatively impacts community members, especially youth. However, before this legislation came into effect, a BC Supreme Court injunction was granted, based in part on the Section 7 Charter rights of people who use drugs. Given the scope of the crisis, it is apparent that decriminalization is only one strategy that must be part of a broader, multifaceted response. Additional strategies include increased efforts in the area of education, prevention, treatment, and the provision of enhanced health services to communities across BC. While much work is occurring in these areas and significant investments of public resources have been made, it's clear that while decriminalization was able to come into effect in a relatively short time frame, these other strategies will take significantly longer to achieve and implement. While working towards better health outcomes for people who use drugs, there must also be consideration of the needs and well-being of the broader public. I believe that other jurisdictions that have implemented or considered decriminalization only to later abandon it have done so because of unaddressed and unintended impacts on community safety and well-being. Thank you.
Thank you, Ms. Wilson. Next, from the Canadian Association of Chiefs of Police, Rachel Huggins. Welcome to the committee. Ms. Huggins, you have the floor.
Thank you. Distinguished members of this committee, I'm pleased to have the opportunity to address you today on this very important issue. It's important to begin by noting that law enforcement agencies across the country acknowledge that the opioid crisis is a public health issue. While police have a critical role to play in terms of preventing illicit drug distribution, curbing supply, and safeguarding communities, we recognize and understand the need for a comprehensive approach that addresses the social determinants of health. This requires coordinated efforts across government, healthcare, the justice system, police, and community organizations. In July 2020, the Canadian Association Chiefs of Police called for a broad societal response that includes prevention, education, support systems, and access to treatment for those affected by drugs. We also supported the decriminalization of simple possession of illicit drugs as an effective way to reduce the stigma of substance use disorders, reduce public health and safety harms, and divert individuals with substance use disorders away from the criminal justice system. As you heard from my fellow co-chair of the CACP Drug Advisory Committee, Deputy Chief Fiona Wilson, our early experiment with formal decriminalization for simple possession of illicit drugs has had some unintended, but not completely unexpected consequences. Preliminary results of this pilot project has proven what police leaders have stated from the beginning. Decriminalization of drugs for personal use is not one part of a system. It has to be part of an integrated, health-focused approach to address the opioid crisis and toxic drug supply. Today, the CACP reaffirms that its commitment for a health-centered approach to the drug issue, and that the opioid crisis and that addressing the opioid crisis include the decriminalization of possession of illicit drugs. Sorry, just 1 second. Sorry about that. In the past 4 years, important procedural and legal reforms, as well as training, have been implemented. These have led to significant shifts in police and public perception about substance use disorder, as well as a decline in simple possession charges, thereby reserving criminal sanctions for the most serious circumstances. Decriminalization is about preventing the unwanted criminalization of personal substance use, creating a continuum of care that ensures persons who use drugs are better connected with health supports, and finally, third, allows the police to use and focus on serious illicit drug trafficking and production offenses. The pilot project implemented in British Columbia succeeded in achieving the first goal, which is procedurally and fiscally and easy to attain. Creating a continuum of care is much more challenging, as well as resource intensive. But the successful achievement of goal number 1 depends on the successful implementation of actions to support the achievement of goals 2 and 3. From a police perspective and police leaders, we see the importance of the critical importance of having the appropriate health and social structures in place before proceeding with changes to legislative frameworks that would formalize the decriminalization of simple possession. In conclusion, From a public safety perspective, Canada's police leaders believe that the success of any strategy in relation to the ongoing crisis of toxic drug supply should be measured based on its ability to improve health outcomes, reduce the impact of organized crime, address the proposed crime and public safety issues that result from unaddressed substance use disorders. The CACP believes that any strategy that is considered must be medically led, be based on empirical medical research, and provide increased health connections with medical professionals for people living with substance use problems. Thank you.
Thank you, Ms. Huggins. And finally, the Royal Canadian Mounted Police. You have 5 minutes in total. I'm not sure whether it's Mr. McDonald or Mr. Ng or whether you're going to split it, but you have the next 5 minutes all to yourself.
Thank you, Chair. Good afternoon. I'm Deputy Commissioner Dwayne McDonald, the Commanding Officer of the British Columbia Royal Canadian Mounted Police. I oversee over 10,500 employees, of which 6,800 police officers. We deliver municipal, provincial, and federal policing throughout BC. I would like to acknowledge that I'm joining you here today from our headquarters that is situated on the unceded territories of the Katzie, Kwantlen, and Semiahmoo First Nations. And I'm joined here by Assistant Commissioner Will Ng. He's our Criminal Operations Officer for British Columbia, and he serves as a single point of control and coordination of all investigative intelligence and specialized RCMP resources within the province of BC, ensuring alignment and enhanced delivery to the municipal and provincial contract partners. Thank you for giving us the opportunity to speak today. We're here to provide perspective and information about the impact the opioid crisis is having on policing for the RCMP in British Columbia. I'll explain our role, our training, our challenges, and some recent investigative findings. Since 2015, the RCMP have been grappling in British Columbia with the alarming rise in overdose deaths, fueled by the increased prevalence of fentanyl in the illicit drug supply. This crisis has not only claimed thousands of lives, but has also left a profound impact on our communities. Since the declaration of a province-wide health emergency in April of 2016, over 13,000 lives have been lost to toxic, unregulated drugs in British Columbia. This is a crisis that knows no bounds, affecting people from all walks of life and communities across the province. Indigenous communities in BC have borne a disproportionate burden of the crisis, facing higher rates of opioid addiction, overdose, and death compared to the general population. Persons with mental health disorders or poor mental health are also overrepresented among those affected by the opioid crisis. It's clear that this is not just a law enforcement issue. It's a public health crisis that demands a compassionate and comprehensive response. As you are all aware, as of May 31st, 2022, BC became the first province in Canada to receive an exemption from Health Canada under subsection 56(1) of the Controlled Drugs and Substances Act, which decriminalized the personal possession of illicit substances. We are now in our second year of the exemption, which is valid until January the 31st, 2026. The BC RCMP continues to support our partners and stakeholders as we all work through the implementation of this exemption. As a police agency, our role is to redirect people in possession of small amounts of certain illicit drugs away from the criminal justice system and towards health and social services. The RCMP continues to support all efforts to ensure that an overdose emergency is dealt with as a health and medical emergency. Emergency medical dispatchers assessing calls no longer call for police assistance in every drug overdose emergency. Police are only notified in overdose calls in circumstances where the situation is believed to be dangerous to first responders or members of the public, or for suicide attempts, whether drug-related or otherwise. It's crucial to note that drug trafficking remains an offense under the Controlled Drugs and Substances Act, and the RCMP is committed to investigating and prosecuting such offenses. Additionally, the RCMP prioritizes upholding the rule of law and ensuring the safety and security of the communities it serves by targeting violent offenders, deterring youth from joining gangs, and combating gang-related violence resulted from the drug trade. Efforts also include dismantling drug production labs and curbing cross-border trafficking, including importation of precursors. To support the implementation of the exemption and ensure consistent enforcement, the RCMP collaborates with the BC Ministries of Mental Health and Addiction and Public Safety and Solicitor General, as well as our law enforcement partners to provide training and resources to frontline officers. We've equipped our officers with the skills and knowledge necessary to navigate the complexities of the exemption and respond effectively to overdose emergencies. However, challenges persist. Despite the progress made, the management of public drug consumption following decriminalization remains a concern. Additional legislation is needed to address public consumption in non-exempted areas. We're actively monitoring the provincial government's effort in this regard, and we also continue to work with our cities and our Indigenous communities to address public safety concerns surrounding the unintended impacts of public consumption. The diversion of safer supply into the illicit drug trade also presents an emerging concern that requires forthright attention. Through ongoing investigations and collaboration with health authorities, we are working to better understand and address this issue to prevent further harm. Efforts are underway to improve our data capture and our analysis with the objective of developing a clearer understanding of this issue. Furthermore, we are currently working to develop training and education tools to help support our frontline officers recognize diverted safer supply. We also recognize the frustrations and challenges felt by our Indigenous communities who continue to bear a disproportionate burden under the opioid crisis. As partners in this fight, the RCMP is committed to working alongside Indigenous communities and agencies to develop and implement long-term strategies to address the root causes of drug addiction. We will also continue to hold accountable those who traffic drugs in these communities. In closing, I want to reaffirm the RCMP's unwavering commitment to tackling the opioid crisis here in British Columbia. We will continue to partner with government agencies, communities, and stakeholders to save lives and bring an end to this devastating crisis. Thank you for the opportunity to address the committee today. Myself and Assistant Commissioner Willing are available to answer any questions you may have.
Thank you very much.